Before we get started, I'd like to also acknowledge the traditional custodians of the land on which we're meeting today and pay my respects to elders past, present and emerging. So, the context, I've just mixed up my slides while I've been talking. But the Satellite Health Centres was originally a 2021 state budget announcement of the previous government, formally announced as a satellite hospital program, ultimately to deliver a series of ambulatory facilities to ease the burden on the existing acute care hospital facilities across the southeast Queensland. The program sought to roll out a series of like ambulatory facilities in growing communities, locate the facilities within those communities in order to bring care closer to home, reduce pressure on emergency departments through diversion of lower complexity presentations, and align service offerings within each facility to those communities to which they were located, and where possible, embracing opportunities to incorporate and integrate outpatient community-based healthcare and virtual care models. So, as stated in the previous slide, the satellite health centres are an expansion of healthcare services. At a high level, they provided local communities with minor injury and illness clinics, medical imaging and diagnostics, and additional referral-based outpatient services. We'll go into a little bit more detail about the service mix later on in the presentation. But ultimately, the increasing pressures on our existing hospital facilities, combined with the projected service need requirements over the next 5 to 10 years, provided a clear and compelling case of a significant capital investment and ultimately the election commitment of 2021. However, as part of this, Queensland Health were faced with a couple of fairly significant challenges, the first of which being the concept of a new brand of facility, which initially was badged, as I said, as a satellite hospital, but would not necessarily meet the standard definition of a hospital. The next was a requirement for the facilities to be delivered in an accelerated manner in order to expedite the provision of these services to those communities to which they are located. And the third being working with the hospital and health services to introduce the minor injury and illness clinics as a concept. While there were various examples in other states or across the ditch, there were limited proofs of concept within Queensland, and there was much concern around how these could actually benefit the emergency departments, and there was a lot of concern around the potential that they would actually attract latent demand, given at the same time waves of GPs were actually, GPs that historically bulk billed, introducing out-of-pocket charges in order to survive. So on this basis, it required a complex ecosystem in order to actually roll out the projects, and so multi-agency engagement was essential. To touch on a couple of points here, the program board was established by Queensland Health and included Queensland Treasury, Premier and Cabinet, Public Works, State Development and the 4 hospital and health services in order to oversee the planning and the delivery of the program and the specifics of the projects themselves. There was also an interagency working group which was set up for cross-government coordination with those same agencies, particularly because of the accelerated nature of the requirements. And to give an idea, land searches, selections and transactions had to be completed in weeks rather than months. Planning approvals under ministerial infrastructure designations, which was a process which in many instances could take up to a year, were required to be completed in months. And business case development, design, cost modelling and program level managing contractor engagement were also required to be undertaken concurrently while the sites and the planning approvals were being locked down. So just outlining this slide are the collaborators that work with Queensland Health in order to ultimately design, deliver and commission these facilities. And in addition to what's up on the slide there was also TSA Riley worked with us in the business case phase right through to schematic design phase.
So I'm going to talk a little bit about the locations. These were all 7 centres were located in southeast Queensland, an area of huge population growth. The locations were across 4 hospital and health services, as Todd mentioned, and across various traditional owner groups. So we had the Kabi people to the north and the Turrbal and Jagera people to the south. And the communities and cohorts that these centres are located in are all quite different. So this is probably a good time to talk a little bit about the brief. Being a program of work, the brief was for a high degree of standardisation. These facilities are all going to be the same. So we've got some common themes with the previous presentation. But because of differences in the HHSs, the locations and the communities they serve, they were also necessarily different. And you'll see as we talk a little bit more about the outcomes, these facilities are the same but different. In terms of the locations, one of the key things was that they had to be located in proximity to the major hospitals. Being satellite centres, they're linked very closely to major hospitals, and with some of our facilities, they're actually linked to a couple of major hospitals. So this really informed the service offerings at each of the centres, and as we got into the detailed design, it also resulted in differences in how the same service might function in each of the centres. In terms of the communities, it's probably worth outlining a little bit more about the differences in some of the communities. One of our facilities is located at Bribie Island, which is a very popular retirement destination, so it has an older cohort and community. Another facility is located at Ripley, in the west out towards Ipswich. This is a newly developed area with affordable housing that attracts young families. Our Redlands facility services the mainland Redlands community, but also the Moreton Bay Island community. So all quite different cohorts and communities with different requirements. Continuing on with the theme of same but different, as Todd mentioned, this program happened really fast, so we were undertaking land acquisition at the same time as the business case and concept design. We undertook many test fits on multiple sites, but these are the 7 sites where the facilities have been delivered. And as you can see, they're all quite different in their configuration. They all have quite different contexts. They're all in the suburbs. That was a key part of the satellite program, but they're quite different suburban contexts. They have all the same elements, all the same puzzle pieces, but the puzzle pieces all fit quite differently in terms of the site planning. So they all have a similar facility, same number of car parks, similar plant, but access to the site is quite different. Some of the sites are flat, so in terms of topography, some are flat, some have very significant slopes of 14 metres across the site. They all have different proximity to things like creeks, train stations, airports, cliff faces. So there were all sorts of site challenges that had to be reflected in the site planning. And with that fast program, we had to have a really clear structure of how we were going to drive that consistency across the program, but also respond to the differences across each of the sites. And decisions had to be made really quickly. So we had a regular cadence of meetings where we had executive user group meetings that were attended by all 4 HHSs as well as HIQ and Public Works Department. And the design team had a really a key role in attending all of those to ensure that consistency that was agreed on at that EUG level flowed down to the project user group meetings that occurred with each HHS quite separately. The design team had a site lead for each of the sites, which is where we really drilled down into that detailed design with the clinicians at each of the major hospitals and within each of the HHSs. And then this flowed through to the health service offerings. So the government election commitment was to deliver minor injury and illness clinics and outpatient services across all 7 centres. And this also involved medical imaging across all 7 sites. But then there were different health service offerings depending on the HHS needs and the major hospitals. So in some cases, it was medical day, offering chemotherapy and infusions. In others, it was renal services or oral health. And this matrix gives you a pretty good idea of the different mix across the 7 centres. So in terms of being the same, they all had the very same compact GFA of 2,250 square metres. But within that space, we were delivering different service offerings. So you'll see in the blue there, they all had the minor injuries and outpatients, medical imaging, but then they had quite a different mix. No 2 centres were exactly the same. And even within each of those services, there were slight differences. So some services had renal chairs of 12 and others 9. So subtle differences the whole way along.
Okay, so while we didn't have the budget of any Saudi princes on this project, we absolutely did go into the project with the idea of creating value with what we had. Something that was really important to us was to create a community space. Through that, our aspiration and concept really revolved around that idea of community. So we had guiding principles that were themed around journey, nature, community focus, and local context. And through that, we had key strategies. And the reason these were important was we were designing across multiple architecture firms with many different stakeholders, with a builder as the client, and that allowed us to have an alignment on what those really important key outcomes were. So the concept around, I suppose, removing the perception of an institutionalised space was something that came up a lot for us, really focusing again on that idea of a community facility, focusing on the front door, the journey through the building, creating a sort of living room feeling throughout the spaces. And they were all sort of developed from these design keys that we just spoke about. So nothing groundbreaking or new here for probably most of you in the room. However, as I sort of alluded to before, these were some really simple diagrams that we could keep coming back to, and whenever things were up for discussion or debate to sort of change things around, we were always able to come back to these design keys. Some of the key ones there are around the central courtyards. So we all 7 sites ended up with a central courtyard with different functions in the end. We have a concept of warm handovers. Again, something really important that we were able to sort of fight for throughout the whole process, and we'll go through the outcome, I think, shortly. We also had some keys around our form and envelope, so H-plan, allowing light into the spaces, and the idea of sort of local materiality and the conceptual references. So landscape design was done by Dun & Moran Landscape, so they were a really important part of the process as well. So the design key, I suppose, in practice, the H-plan, nothing new, but again, surprisingly very important to be able to keep coming back to and saying, you know, this is a key that we wanted to keep throughout the whole project. So by not having a floor plate that's too deep, we're always ensuring that there's connection to outside, connection to natural light, which we all know is really important. It also allowed for a little bit more interest in the facade, having sort of some depth and things like that. So in practice, the subweights were our warm handovers. Again, the sort of design key from early on, something that we were able to keep bringing back to the importance of this space. So reducing large waiting areas into these warm handovers, alluding to that sort of Disney model with a bit of a distraction of views outside, materiality, making you feel like you're in more of a living room than an institutionalised space.
So just building a little bit more on the H plan idea, we did have a H plan at all of the centres, and the patient journey was remarkably similar across all 7 centres. Patients arriving at the car park, entering a beautifully landscaped shaded entry courtyard, arriving at the front of house, waiting reception area, and then being directed to clinical services in each wing of the H plan. A courtyard behind reception and back of house behind that. The H plan was very effective in terms of very efficient circulation. With our very compact GFA, we really tried to get as much clinical space and be as clever as we could be with our circulation. But the H plan was also really effective in terms of wayfinding, with no area very far from that front of house area. You'll see these are 4 of the H plans from 4 of our sites, and there are necessarily some differences. So the different health services obviously led to some differences in the H plan, and also the actual site planning. In particular, you'll see Tugun in that top right-hand side. The configuration of the site meant that we had to crank one arm of the H plan, so same but different. I'm not going to spend too long on this one, but in terms of the built form, very, very simple structures to help us with managing budget. Single level, simple skillion, which we felt settled really well into their suburban context. And we also brought in suburban materials, so brickwork, timber, which again fitted really well with the surrounding residential development. In terms of our interior design strategy, we had the same palette of materials across all 7 sites. And I've already mentioned the warmth of the face brickwork and the timber. That was reinforcing that non-clinical feel. But then we had a different colour palette depending on where the centres were located. So you can see here that the 3 different schemes that were selected for the 7 centres depending on where they were located, whether they're near the ocean or the bush. You'll see some of the images here. One of our design strategies was to really have the flow of the outdoors indoors, so that was to connect the landscaping to the interiors, and you'll see our materials flowed from outside to inside here. That's one of the warm handover waiting areas in the centre there, with the brickwork and timber flowing through. And we also had different colours for the different health service areas to support the wayfinding, with timber portals as you transition from one health service to another.
Just a quick snapshot of the final buildings, 6 of them. So we're really just trying to illustrate here that they are community facilities. They are embedded within quite a suburban environment. So this is just showing you that scale is very low compared to perhaps what you might have originally thought when you heard about it being called a sort of satellite hospital, which it isn't. So really just trying to show the scale of it and the simplicity. You get the idea of how they are all similar, trying to make it feel a lot more welcoming than a large space. And looking through the interiors, again, these are the 6 different sites. So you can start to see how the similar materials are used throughout similar spaces, with slightly different colour variations and application of material as well. I suppose also in this image you can see those waiting areas and the staff base on the bottom left, where we've managed to get natural light into into the middle of the space, which was quite a nice feat for the staff in that area. So we spoke earlier about that idea of a warm, welcoming entry. So these are two different buildings here, and the entrance into them. So we managed to have all of the sites with some level of integrated artwork, all completed by First Nations artists, which was really an incredible experience to be a part of. They all were differently applied. So on the left-hand side, there is an artwork applied to 8 Mile Plains by Arthur Walsh. So that artwork kind of has been applied directly to the building, and it wraps around that whole entry forecourt, which you can't see the entirety of it at the moment, but it really creates a welcoming space that the community can kind of come in and congregate around before going into the building itself. And on the right is Ripley Satellite Centre, and it has got a screen that's been integrated with artwork by Maurice Woodley. So that was created by working quite closely with the artist and the architect to apply the artwork to the screen perforations there. Now, post-occupancy evaluation. So this is Dr. Wai's work. So if you have questions, hold them for her later. I'm sure she will be more than happy to talk to you about it in great detail. But I will touch on some of the findings. So Architectus collaborated with Westmoreland Health and Hospital Service to conduct a POE 12 months after occupancy. The main purpose was to gain feedback through specific questions, and then an assessment of the patient, visitor and staff views and experiences was undertaken, as well as a workshop which created an opportunity for key stakeholders to identify areas for further enhancements. So a really important part of the process. So I am just going to touch on a couple of the questions, which hopefully talk to some of the things we mentioned earlier. So through the patient and visitor survey, the participants, I think there was 32 participants, and they were asked a series of questions, one of which was asking them to rate the ease of access to the hospital on a scale of 1 to 10, with 1 being hard and 10 being easy. So the majority of people, you can see in that bar graph at the bottom there, found it pretty easy to navigate to the site. I just called it a hospital, it's not a hospital. So that's really good. It's kind of obvious they're built within the community, so probably nothing too unexpected there. And then when asked how patients and visitors navigate their way around, the majority of the respondents would approach the reception desk before moving on to where they needed to be in the space. The spaces were kind of designed that way, so that also makes a lot of sense. And then secondary to approaching reception, first of all, they would then move on to using the signage throughout the building to be able to find their way around. And then the waiting areas and interior of the space. So really trying to understand the perception about the interior environment. So we spoke a lot about creating a warm, welcoming environment. So did we actually do that, or is that just something we like to talk about? Turns out that the majority of respondents actually did express a contentment with the aesthetics, specifically appreciating the view to outside. So that was really quite an important response that we were able to collect there. So 78% of the people that responded felt that the colour and the design of the space made them feel comfortable. Again, have a chat with Wai later, and I'm sure she'll be happy to go through more of that.
So the performance. In February 24, prior to the complete rollout of the program, there was some public announcements from early stage data which actually showed that pressures on some of Queensland's busiest emergency departments had actually eased since the introduction of these satellite facilities. Further to the POE outcomes, there's also various instances of communication from staff and consumers alike, which provide positive indications regarding the role of these facilities in the system and the communities they're located. As part of the rollout, there were changes as we progressed through, which happens with a lot of these projects. So particularly with the Ripley site, halfway through, they'd also identified that they were going to co-locate a 90-bed subacute facility right next to the satellite and needed to connect it. So there were some adjustments made there. And certainly from a Metro South perspective, in order to support the experience or the waiting room experience, a containerised coffee cart was jammed in at late stage construction in order to make sure that we could provide a decent coffee offering. So there have been some lessons learned along the way. And look, just quickly before I go to the next slide, you'll notice that there are some numbers just at the bottom here of MIC arrivals. That are actually monthly figures, and that I think was April. And that information is actually available publicly. So on the Queensland Health website, under our performance, all the information around each of these facilities and how they're performing, at least at a high level summary, is available for information. So Queensland Health is committed to ensuring the satellite health centres are achieving the aim of providing healthcare closer to home and easing pressure on emergency departments. In alignment with the Queensland Treasury Project Assurance Framework, the process for infrastructure projects is that a benefits realisation would be run. Certainly will include some of those POE outcomes. But the department is actually in the process of undertaking evaluation now to, I guess, understand if they are doing exactly what they aimed to do via a deep dive into data and to inform the next round of planning and certainly any further ambulatory facilities we're looking to do in the same manner. Now, in all transparency, the plan was, when we planned to do this at the early year, that this evaluation would actually be completed before the conference, and then I could share a couple of key takeaways. In lieu of that, what I've put up on the screen at the moment is the underpinning questions of that evaluation process. So even though I can't share any of the actual outcomes, this is what we're working on at the moment, and will ultimately inform our next lessons learned and planning regime for these like facilities into the future.